Next we discuss prescriptions and when they go wrong. 0500 288 291. Do call, do email. BBC Radio 2. 1 in 6 patients has been given a prescription by their GP which is wrong in some way, according to a review by the General Medical Council. The most common problem was incomplete information, followed by problems with dose and timing of doses. 4% of the errors were judged to be severe, and they included cases where patients were given drugs which they were allergic to, and a lack of monitoring of risky drugs such as warfarin, which thins the blood. The study looked at 1,200 patients and found prescription mistakes were most likely to affect the elderly and the very young. Perhaps a serious mistake was made with one of your prescriptions, was it? We'd love to hear from you. If so, 0500 288 291, email vine@bbc.co.uk. Going to speak in a moment to Professor Tony Avery, who led the review, and also to the Radio 2 GP, Dr. Sarah Jarvis. So, what is this? It's just slapdash work, is it, Tony, or what?
Well, what I'd like to first of all say, Jeremy, is that the vast majority of GP prescribing is both safe and appropriate. But we did find that indeed that 1 in 20 prescription items had an error associated with it. And just to
I had 1 in 6 here. So
let me try and just explain that. We actually examined the records of 1,700 patients over a 12-month period, and 1,200 of those patients had 1 or more prescription items. In fact, on average, those 1,200 patients had about 5 prescription items or unique prescription items. And so the error rate that's being quoted in the news media today, that 1 in 6 have a prescription with an error on it, is that 1 in 6 patients who have at least one medicine will, over the course of the year, and as I say, on the average, these patients had 5 unique prescriptions, and then 1 in 6 of those would have a prescription with an error on it.
I see, and there are errors and there are errors. How many of these could be fatal?
Relatively few. The figure that we got for the most severe errors was that 1 in 550 prescription items had something on it that if you had a cascade of events whereby an issue wasn't picked up and a patient continued to take a particular medicine, and they then were unfortunate to actually have a serious reaction, then they could have been fatal.
And you treat it as if the patient always unquestioningly takes the medicine and the dose from the doctor. You don't allow for the fact that lots of patients are smarter than that.
I think it's really helpful that patients are smarter than that,
because they Google stuff and they ask their friends, and they look and they see they've been given a 20 milligram daily dose, and the average that's given is 2, and it doesn't look right.
Yeah, I think it's extremely helpful that patients and members of the public are actively involved in the use of their medicines. It's a partnership. Clearly, the main responsibility lies with us as GPs and other prescribers. But if we're working together on this, I find it extremely helpful. If patients come to me with queries about their medicines, so that we can sort out problems and try and avoid, the potential errors or patients actually suffering from harm.
Are the errors usually human error or computer error?
It's a whole mix. Computers in general actually help us with various aspects of our prescribing and help in terms of certain aspects of safety. They can, however, introduce new types of error that you just wouldn't get with writing by hand. For example, we have computerized pick lists where you have to pick a drug or a drug dose from a drop-down menu, and GPs in our study reported that they had occasionally picked up the wrong strength, for example, from a drop-down menu. In terms of human error, then that is, as you say, an important issue. I mean, I think all doctors take their prescribing seriously, and all of us dread, making the sort of error whereby, a person might receive a 5 times overdose because you've selected the wrong drug for it, for example. And I think we all have have our own ways of trying to avoid making those sort of slips and mistakes, but inevitably they can happen. And so the sort of things that GPs reported in our study was the overall pressure of work, interruptions, distractions, and also the fact that the prescribing process often gets squeezed right till the very end of the consultation, and therefore there's not necessarily enough time to really check things. Well, I'd hope that we always would check things, but to check things, explain things to the patient, it perhaps doesn't get the attention it deserves within the short consultation.
Thank you very much indeed, Professor Tony Avery, who led the study for the GMC. Dawn from Newark in Nottinghamshire says, I have been on various antidepressants and I've been on painkillers for spinal damage. After another change of antidepressant in December 2010, I told my GP that the leaflet inside the package said it was incompatible with the main painkiller he was prescribing. He said he hadn't heard that before and moved on. In May I was so ill that I rang NHS Direct and they told me I must see my GP urgently because the incompatibility of the medications was causing my liver to fail, and they did change it immediately. And Sarah, that's something we haven't got onto yet, is when you mix one medicine with another.
It's a huge issue, and of course that's the main reason that older people are much more likely, 4 in 10 older people are more likely to have had mistakes, because they're the ones taking more medication, but they're also the ones most likely to be taking warfarin, and warfarin was responsible for almost all the serious prescribing errors here. We can't afford to be complacent about it, but frankly there is no excuse when someone's on a drug like warfarin, which causes so many problems and which needs to be monitored so carefully, for the doctor not to make arrangements for the patient to be monitored.
And warfarin is the cause because it's very commonly prescribed, and prescribed across a big range. Is that the point?
That's part of the problem. The real issue, though, is that warfarin, if you give too little of it, you don't protect people. For instance, with atrial fibrillation, someone who's got AF, the most common heart rhythm problem in the UK, about 1 million people have got it, they're almost all older, and it increases your risk of having a stroke by 500%.
Wow.
If you take warfarin, you can drop that risk dramatically, but if you don't take enough, it doesn't protect you. If you take too much, you can get a fatal bleed, and there's a very, very narrow window of opportunity. Lots of other drugs, you could give 1 dose or 4 times as much dose and still be safe.
How interesting.
With warfarin, there's a tiny dose, and to make things even more complicated, not only does it interact so your levels will go through the roof one day because you've eaten Brussels sprouts the previous day or had 1 too many cups of coffee, it also interacts with loads of drugs, and there's no telling how one patient will react.
Thank you very much, Dr. Sarah Jarvis, Radio 2 GP, talking about prescription errors. If you have had a prescription error with the dosage or the drug or the mix of drugs, do call. Meanwhile, it's prescription, and prescriptions that are wrong drug, wrong dose, more likely. Quite a few are. Sarah emails and says this is simply not good enough. Our GPs are paid huge salaries for their knowledge and expertise, and these errors should not happen. The GP on Breakfast this morning, BBC, seemed almost complacent about it. If the job was easy, we would all be GPs. More care and attention is needed because our life is theoretically in their hands. Paul Kaminsky is in Fife, and Paul says, I've had serious spinal problems since 1996, and over the years I've taken all kinds of painkillers to ease the pain. I always go to the same chemist. I've been going to her for 10 years. She's spotted numerous problems with the prescriptions and has on occasion refused to give me my prescription because she's on the ball and knows the drugs prescribed wouldn't be right for me. And if it weren't for my brilliant chemist, I don't know what cocktail of drugs I'd have ended up taking. But let's hear it for the chemists. 0500 288 291. Paul Wenham Clark is in Newbury. Paul, you almost had liver failure because of a wrong prescription.
Yes, that's right, yes. I had like a fairly sort of minor throat infection, and I went to the doctor about it. It was my normal GP, and he prescribed a course of amoxil, which is a fairly normal antibiotic. But I didn't realise he'd prescribed such a large amount of it for so long, and so I just took the course of drugs as they tell you to do, to take it to the complete end.
Yeah.
And then I did, and then from that point on, I got like the symptoms of dysentery. I was really, really in a bad way. I was, just couldn't even drink water. I kept going back to him and saying, I'm still not well, what can you do? And he was just, well, it'll sort itself out, it will just work its way out, you'll be fine, And it went on for about 3 weeks, and then I went back to him and said, look, I need to see a specialist or something. And I had private health care, so I said, send me on to a specialist. And so he did, reluctantly. And I went to the appointment with the specialist, and they examined me for about 20 minutes, and at the end they said, right, we'll have you in hospital right now. And I went to the hospital, and they did loads of tests, and they said, you're about 3 days away from liver failure, you're so dehydrated.
And is that because the antibiotics dose was too high or too long?
Yeah, I think it was both. I mean, the doctor at the hospital said that it was too high, it was for too long a period, and basically it killed all the good bacteria in my body. And the only way that they could get me back on track was to give me, other antibiotics and to give me, reintroduce the correct bacteria back into my gut.
Caramba, and you're okay now?
Yeah, I'm okay now. I mean, this is quite a while ago.
But it took a while to get better.
But I was in hospital for a week, and I couldn't work for a month. And as a photographer, that was like a total nightmare.
I'm sure it was. Paul, thank you very much.
Thank you.
And well, that's amazing, isn't it? And the question is whether you go on the internet and type it into a search engine and have a look at what other people are taking, and is this a long dose or a too high a dose, or is that just one of those things where you just make yourself a pest to the NHS because we're not doctors. Bob Marshall in Coventry says, I live in France these days. When you take a prescription to the pharmacist, they check it through thoroughly, and they will check with the doctor if necessary. They are liable for any mistakes, so they avoid them. Joanne is in Rutland and says, I took my 3-year-old son who was having trouble breathing to an out-of-hours doctor on a Sunday at a local minor injury unit, and he prescribed him a steroid inhaler, but the dosage strength was for an adult, and that was picked up by the pharmacist when she did the prescription. If she hadn't noticed, it could have severely damaged my son's lungs. And let's see, one more before some music from Emily Sandy. And it's Jason in Warrington who says, my wife gave birth to our daughter 8 months ago. When she was pregnant, the doctor prescribed her a drug which was very, very dangerous for pregnant ladies. The pharmacist again spotted the mistake and took her off the medication immediately. We're getting some heroic pharmacist stories here, so if you're working in a chemist today and it's you, well done. Here's Emily.